All right. So I'm going to go ahead and get started here. We're happy to have you join us this evening. And give me one moment here. There we go. All right, so good afternoon, everyone, and thank you for joining us this evening. Welcome to another episode of the Wild Sheep webinar series. I'm Amanda Verheuel, the Executive Director of the National Bighorn Sheep Center, and our mission is to provide education and outreach for the national conservation of wild sheep, wildlife, and wildlands. I would like to thank our partners and viewers for your support. The collaborations and connections that we have with others is really the key to our success. Today we present the Wild Sheep Initiative Test and Remove Program. Respiratory disease, particularly pneumonia, initiated by MOV, significantly impacts bighorn sheep throughout their range in the US and Canada. Historically, no effective management strategies have been able to slow or reverse herd declines due to pneumonia. Test and Remove is being tested and refined to improve its effectiveness in eliminating MOV from chronically infected herds, increasing lamb survival and recruitment, and creating a stable and resilient bighorn sheep population. But what does this look like now and in the future? And can we sustain the amount of sheep that we had back in the late 80s or early, in the 1900s? Joining us this afternoon are Daryl Lutz and Dr. Francis. Francis, say your last name one more time for me here.
Cassirer.
Cassirer, there we go. I just want to get it right. Daryl became the Wild Sheep Working Group WSWG Chair in 2022. He went to the University of Wyoming and Humboldt State University. Daryl has been a biologist for the Wyoming Game and Fish Department for a bit over 3 decades. As a habitat biologist, wildlife biologist, and now a wildlife management coordinator, and continues to serve in that capacity as he chairs the Wild Sheep Working Group. He has been heavily involved in mule deer and bighorn sheep management throughout his career. Daryl led Wyoming's Mule Deer Working Group and represented Wyoming on the WAFWA's Mule Deer Working Group for over 20 years, since their inception in 1998. He has also co-chaired Wyoming's Bighorn Sheep Working Group for several years. Daryl was raised as a hunter, fisherman, and outdoorsman in Colorado and Wyoming. He and his wife raised their 2 kids the same way and are now working on their 5 grandkids. Dr. Francis Cassirer is also with us this evening. Francis is a wildlife research biologist for the Idaho Department of Fish and Game. She has worked on many different wildlife research projects, from trapping and monitoring wolves in northern Minnesota to studying the effects of disturbance by cross-country skiers on the elk in the North Range of Yellowstone. Francis has long been a leader in gaining knowledge through cooperative research with universities, state, and, sorry, I'm admitting people into the waiting room as I'm talking here, federal wildlife and land management agencies. Over the last 25 years, Francis has been involved in numerous bighorn sheep studies, including the Hells Canyon Bighorn Sheep Initiative. For decades, Francis has dedicated her career to research to resolve disease issues plaguing bighorn sheep. Her efforts changed bighorn sheep management. Biologists now have a tool that can be used to improve the health of bighorn sheep and increase survival. Her work helps biologists estimate the disease risk to nearby herds. Francis has been involved and co-authored numerous publications, including Genomic Association with Pathogen Carriage in Bighorn Sheep, and Dynamics of Pneumonia in Bighorn Sheep Metapopulation. Please take it away, Daryl.
Yeah, thank you, Amanda. Really appreciate the opportunity to spend some time with you all this evening. But really, the person we want to listen to is Francis. Francis is kind of the mother of Test and Remove. She has probably more experience than anybody else with Test and Remove in North America. And so I'm just going to lay a little bit of groundwork from a population manager standpoint, where we're at with primarily bighorn sheep management, but truthfully with wild sheep management in general. But before I get there, I want to talk to you just a little bit about my role as the chair of the Wild Sheep Initiatives, the WAFWA's Wild Sheep Initiative. This group has been pulled together, has been in existence since 2007. And other than me, it is a group of the brightest and the best wild sheep managers in North America. Every time I get around these folks, Francis included, I learn a ton. And so I just want you all to know that the Wild Sheep Initiative exists, and it's working diligently and hard to share information, to be innovative about wild sheep management, including test and remove, and is working. These people, just as you all are, because you're here tonight, are so passionate about wild sheep. This group is above and beyond any professional group that I've been involved with. So I want to give them a little bit of recognition here tonight and let you know what they are. So this group's committed to the restoration and conservation of bighorn and thinhorn sheep for the benefit of all of us and our future generations. There's over 20 members, 20 member agencies to WAFWA, and 20 agencies that have wild sheep within their jurisdictions. So they are all represented on this group. I'm not going to read that mission, but in a nutshell, it, as I said earlier, is a group of professionals that come together frequently throughout the year and to innovate, to data share, to information share, to collaborate, and to work towards managing wild sheep into the future. I'm darn sure not going to read this slide, but I just want to give you a sense since 2007, the many things that the Wild Sheep, it used to be called the Wild Sheep Working Group, now the Wild Sheep Initiative, has accomplished. And it's been a lot. And you can see here in the middle of the slide a recognition of the test and remove that's gone on. Most recently, we've delved into test and remove in a much more in a much deeper way. Many more jurisdictions are doing it. Wyoming included, just within the last 3 years. So it is, as Amanda said in the beginning, right now the tool in our toolbox to try to combat at least one of the pathogens that causes pneumonia in bighorn sheep. We, on an annual basis, are publishing a range-wide status of big and thin-horn sheep. So if you're interested in how they're doing throughout their entire range in North America, this is a document that you can go get. It's not bad reading for a bunch of technobiologists that put it together. It's actually, I think, well written and something that you might be interested in. In addition to that, in part because of all the test and remove work that's going on, has increased the number of captures a lot over the past over 10 years. But captures that we do to better understand sheep movement and habitat use and everything else. We also recently published wild sheep capture and handling guidelines to ensure that practitioners, biologists, researchers, and others that put their hands on sheep are doing it in the best way, in the best interest of the sheep themselves. All of this is available, and a whole lot more information is available on our website that you can see on your screen. Let me shift gears, because that's all I wanted to talk about with the Wild Sheep Initiative. And really what I want to talk about and instill in your minds is many of us that have been involved with wildlife in one way, shape, or form, even those of us that have gone through hunter safety class, probably know what carrying capacity is. And we all know carrying capacity is a function of the habitats that are available to wildlife. And of course, it includes food, water, shelter, space, and all of those components have to be in a juxtapositioner, they all have to be available for the habitat to be effective to support a wildlife population. And so, as wildlife managers, as a wildlife biologist myself, that's what we've focused on with regard to how we think about carrying capacity. But it's changed. And it's changed in a fairly dramatic way. Our paradigm, as we think about wildlife management, has had to shift because it's not just about habitat anymore, but it's about pathogens and disease. And so, as wildlife population managers, those of us that are concerned about the number of animals that are on the landscape and utilizing the habitats that are available to them, we now have to consider on an equal plane the risk, the threat, and the impact of pathogens and disease. And in particular with bighorn sheep, the pathogen is Mycoplasma pneumoniae, but there are also other bacteria and maladies that cause disease in sheep. So why do we need to be concerned about disease when we consider managing the number of animals on the landscape? Why do we need to be thinking about that when we look at population size and density? And I know many of you know this as well as I do, but as numbers increase or densities increase, the risk of pathogen and disease transmission also increases. But in addition to that, we also have to be thinking about, and as it relates to carrying capacity and the habitats that they have, the nutritional plane that those animals are on and how healthy they are as it relates to their ability to combat disease. And then one thing that's really important to us is we think about, the populations that we have in North America. They exist in distinct populations, but we all know that bighorn sheep, and it's not just rams and it's not just young rams, though young rams are often thought to be the most likely age and sex class to be moving around the countryside, or as we call it, foraying, looking for different places to live, expanding their ranges, and but most often when it comes to rams, they're looking for love during the rut. And so those rams that foray across around the countryside, they oftentimes will come in contact with these harmful pathogens and bring them back to their home populations. So we have to be worried about a lot of things, but we have to be worried about those sheep that are moving about. We all know, and I mentioned it earlier, that nutrition affects immunity and vice versa. It's a bit of a catch-22 and maybe in some cases a vicious circle. And I want to make the point because so many of us, we want to see more wild sheep on the landscape. I think we can all agree that if we could have more, we want more, and that would be better. But when we think about carrying capacity, not just from a habitat standpoint, but compounding that with now the added stresses of disease, more bighorn sheep may not always be better. So in the face of disease management, we think we need to be more conscientious about what's most appropriate in terms of a population level that exists on the landscape. And sometimes perhaps that should be at a level lower than perhaps we would like. And let me give you just a couple of examples. I know not all of you are from Wyoming, but some are and will be familiar with these two herds that I've pulled out of the bag to talk a little bit about. And the first one's the Jackson Bighorn sheep herd, of course, near the town of Jackson in northwest Wyoming, near Grand Teton National Park. We have an objective or a management goal of 400 sheep there, and it appears to be at carrying capacity as we speak. And we know, based upon research that's been done there, that as this herd nears and exceeds carrying capacity, their body condition, their measured body condition, declines dramatically. And we also know that this herd does have Mycoplasma pneumoniae circulating among members of that population. And so, as you see in that graphic just below the bullet points, when we have undernutrition as a function of carrying capacity, then that carrying capacity is further impacted then by the infectious disease, and it's a vicious circle. So pneumonia takes hold and tends to drop this population, as you can see in the graph here in the upper right, with these cycles that we see. And you can see right now, we are what we consider to be certainly above objective and likely carrying capacity, given what we're seeing with body condition. We are putting in place lamb ewe harvest to help bring this population down. So we're trying to manage a herd living with Mycoplasma pneumoniae at levels consistent with their habitat's carrying capacity to keep them in the best nutritional condition we can, so that they can mount a resistance or an immunity to disease. The second herd is a different situation. It's the Fair Seminole herd, north of Rawlins, south of Casper, in central Wyoming. And this herd is the last, what we call clean herd in the state of Wyoming. Right now, thank goodness, it doesn't have Mycoplasma pneumoniae circulating in the population. But as you can see in that graph in the upper right, we're at objective. And the objective here is 300 animals. So we're there. And based on lamb productivity and body condition, we want to keep this herd below that carrying capacity or that objective level, which we think is the two of them are pretty closely aligned, given what we see with lamb recruitment. And so in this herd, to decrease the risk of foraying, and we are seeing some of it as we speak, we are aggressively implementing lamb ewe harvest here to keep this population at a level commensurate with the objective and below carrying capacity. Again, not just from a habitat standpoint, but also to decrease the risk of disease or pathogen transmission in this herd. So, as I've said, we need to manage populations to keep those numbers at or below the objective or carrying capacity. We continue to collect population data and track numbers so that we best understand what appropriate density levels are. I've mentioned that we are instituting ewe lamb harvest in Wyoming in a meaningful way to best manage for these two herds' health. And then statewide continuing to do disease monitoring. And then in northwest Wyoming, to the east of the Jackson herd and the Whiskey herd, we are implementing test and remove to try to salvage a herd that's been suffering from chronic disease for the last 30 years. And if we have time at the end, I can talk a little bit about where we're at with that project. But I want to wrap up by just impressing on you that wildlife management is complex. There isn't anything easy about it. In fact, oftentimes, I think physicists and chemists have a better chance of success because they have absolute solutions. We don't. Population sizes and goals, in our case, objectives, when we consider carrying capacity, now have to be tempered with the risk of pathogen disease. Pneumonia in bighorn sheep, chronic wasting disease in mule deer, brucellosis in elk. And then the third point that I haven't touched on is connectivity is important, of course, for population resilience and genetic exchange between populations, but it becomes more complex. And and more difficult when we think about the risk of disease transmission from bighorn sheep to other bighorn sheep, which some jurisdictions in North America are now starting to experience. It's not just from pathogen transmission from domestic livestock to bighorn sheep, but it's also now bighorn sheep affecting bighorn sheep. So that's all I got to say. That's the end. Amanda, I don't know if you want to do questions or whatever now, or we can go to the better part of the evening and listen to Francis.
Yes.
Yeah, it would be great if we could just, before Dr. Cassirer presents, if anybody has any questions at this time, just to kind of open it up for Daryl, and then if there's things that Francis is going to be addressing, we can kind of hold off on those until the end. Does anybody have any questions at this time, specifically for this local herd? And feel free to unmute and go ahead.
I have a question. Daryl, thank you. That was amazing talk. I really appreciated hearing that. I'm Regina. I'm in Colorado. I work with the bighorn sheep at Rocky Mountain National Park.
Oh, good.
I'm a volunteer, and we're having a decline also due to disease, or so we think. Since that one herd is healthy but at past capacity, is there any talk of transferring some of those to other places rather than all hunting or
Yeah, Regina, that's a great question. And actually I should have mentioned it. So thanks for reminding me. Yes, we do. It is the last source herd in Wyoming for doing translocations or augmentations. And we do have a proposal that's being worked through our public process and actually going to be presented to the commission next month to do a translocation into the Sweetwater Rock. So it's yet to be seen whether or not that's going to happen. But yes, that is a tool in our toolbox to keep this herd at a lower level.
Thank you. And Daryl, Carolyn has a question here. Could you clarify lamb harvest?
Well, so the license that we issue does allow the recipient of that license to harvest either a ewe or a lamb.
Thank you. And that's specific to what areas right now?
Yeah, so we're currently doing it in areas 7, 17, and that's in the Jackson herd, and then areas 17 and 26 in the Ferris Seminole herd.
And I have one more question about that. Do the hunters give you a sample so you can test for disease in them?
Yeah, Regina, so we will, if we can get to if we field check that animal, or if they get it to us in a timely manner, we do try to swab them.
Great, thank you. And if there's no more questions at this time, Dr. Cassirer, why don't you go ahead and share your screen, please?
Okay, did that work?
Looks perfect.
Great. Well, thanks everyone for coming, and thanks to Amanda and Daryl for saying such nice things. I'm just going to talk really briefly about test and remove, as I mentioned. I'm going to start out. Hang on, I'm just trying to get my screen figured out here. Okay. Sorry. having a bit of a can't seem to get my presentation to advance here. Check this again. Okay, sorry about that. So I'm going to talk about what test and remove is, and then I'm also going to present results of a survey of wildlife managers conducting test and remove that was done last fall. And we asked them how they're implementing test and remove or how they have done it and how are things going. And this talk is very similar to a talk I gave at the Wild Sheep Initiative in, I believe, January. So if you've seen that one, there will be some repetition here. So test and remove, the objective of test and remove is to improve lamb survival in populations where recruitment is low and pneumonia is a limiting factor. So it's not just a general disease management tool, it's for this specific situation. And the approach is the objective is to clear MOE, which you've heard about from Daryl, from infected populations to prevent exposure of lambs, because lambs are highly susceptible to MOE and it can cause high rates of mortality. And so the way it's implemented is it's a selective removal action of carriers that have long duration infections. And so the reason what we're selecting these individuals is because based on the research that we've done to date, these are the animals that are responsible for maintaining MOB in the population. And the focus is on females, because although both males and females can be infected with MOB, it seems that females are the ones most likely to have the long duration infections. And test and remove was conceived about 15 years ago, and the first applications were started in 2012 in Hell's Canyon and in South Dakota. And over time, there's been increased interest in test remove, and it's been tried in a number of different places, partly because there was some success in the early attempts, and also because this situation of low lamb survival due to pneumonia-related mortality is pretty widespread in bighorn sheep. And these test remove has been done in all three major subspecies of bighorn sheep: desert, California, and Rocky Mountain. And this is a map of places where test and remove has been conducted, with the areas where test and remove has been or is being done in orange. And that includes British Columbia. They're doing two efforts in their native California bighorn sheep, Washington in California and Rocky Mountain bighorn sheep, Oregon in both California and Rocky Mountain, Idaho in our native Salmon River bighorn sheep, as well as Hell's Canyon, Montana in the Highlands, Rocky Mountain, and then, as Daryl alluded to, in Wyoming in the Wind Rivers with Wyoming Game and Fish and the Wind River Indian Reservation. In Nebraska, in the Pine Ridge area, Rocky Mountain sheep, and South Dakota in the Black Hills and in the Badlands with the South Dakota Game Fish and Parks, Park Service, and the Oglala Sioux Nation. Nevada in both desert and California sheep, and Navajo Nation desert sheep in the San Juan and Lake Powell in Arizona. And so the initial efforts at test and remove were on fairly small populations, just to see if it would work. And most populations where test and remove is being conducted are fairly small, under 100 sheep. But there are some larger populations. The largest one is the Fraser River in British Columbia, 800 sheep, but also Idaho in the Salmon River and Whiskey Mountain, as well as Lookout Mountain in Oregon, and the Highlands in Montana, and a population in Nevada. And as you know, trying to determine what a population is, it's in some ways it's pretty straightforward, but in other ways it can be less straightforward. And one thing about populations is that although you know, they, like I said, there is, you know, pretty good idea of what a population is. Within a population, there's often subpopulations, and especially in bighorn sheep, as well as other species. And so in bighorn sheep, in the populations that we're doing test and remove in, most of them all of them that are over 100 sheep have subpopulations, and some of them under 100 sheep as well. We can use this for implementing test and remove, for sort of breaking down, working through various subpopulations consecutively. And it also has implications for disease transmission within the population. As Daryl mentioned, there's a lot of captures that go on associated with test and remove. And most of the capture is done by helicopter net gun. And although ground darting is also common, is also used in supplementing typically helicopter captures, as well as in Montana, they've done some drop netting, and there is one population in Oregon where it's just all ground darting. Total number of captures that are associated with test and remove really depends on this population size and how long the effort has been going on. But typically, you know, for example, in British Columbia, they've captured over 300 sheep. I'm sure they captured more by now because this information is all from last fall before the winter capture season. But it really does involve a lot of captures, capturing a high proportion of the population. In these captures, a lot of data are collected. It varies across jurisdictions, but everybody is looking at MOV infection status, which is measured by tests on nasal swabs. Also, many places are collecting blood to look at antibody to MOV, to look at exposure status. And there are many strains of MOV, and a lot of jurisdictions are doing strain typing. Daryl mentioned that there are other infections and diseases that bighorn sheep that can affect bighorn sheep, and such as co-infections like Pasteurella and other bacteria and viruses, and diseases like sinus tumors. And so many areas are looking at these factors as well. Some places are doing looking at body condition. Most people are collaring the sheep that are captured, often with GPS collars, and looking at movements and survival. And just about everybody is trying to monitor lamb survival and recruitment with surveys to look with surveys. So the point is that there's a lot of different information that's being collected in a lot of different places. There's a tremendous amount of data. Some initial results on the characteristics of infection and exposure. Like I said, there's a lot of different strains of MOV, but typically there's only a single strain detected in a population. However, in some populations, there have been 2 strains, like I think whiskey, there are 2 strains that have been detected, and up to 4 strains. In Nebraska, in the Pine Ridge, there have been populations of 3 and 4 strains. And the number of strains may affect the ability to clear MOV, and also population with a lot of strains, it may suggest that there is ongoing or recent invasion of new strains of MOV, which also could affect the ability to clear MOV. In terms of infection prevalence, or the proportion of animals that are infected, Typically about 20 to 30% of a population of the females in a population are test positive on a, you know, in a single capture, but there is a wide range among populations and even within populations between years. And some of this is due to removal of carriers and some of it isn't. So overall, in the survey, there was a range between 8 to 70% infection prevalence. And bighorn sheep are highly social. So they're not surprisingly, there's typically about 80% of the sheep at least have antibody to MOV, so indicating that they've been exposed to or previously infected. But again, there's a wide range between 14 and 90% in this survey. And these factors may also affect the ability to clear MOV. Most of the testing that's done, it has been done at the Washington Animal Disease and Diagnostic Lab at WSU, but also Wyoming, it tests their samples or does a lot of testing at the Wyoming Game and Fish Wildlife Health Lab. And in British Columbia, they use the Animal Health Center in Abbotsford. Wattle, all these three labs run PCR for MOV. Wattle and the Animal Health Center use the same PCR. Wattle is the only one that has the test for antibody. And I believe they're the only one that is currently doing strain typing. Something that's been being tried for several years, and I think it's kind of coming into its own, is field testing, a field PCR. So using the same test that's done at the labs, but with a portable field machine to run PCR. And we have been using a machine made by Wyoming, and we're right now doing a validation of Wyoming with the lab testing, and it's looking pretty good so far. And will be this is done with spiked samples of known infection status, submitting them to both labs. So hopefully we'll be able to do more field testing in the future, which would be really helpful in cases where you're going to take some management action on the result of the test. So rather than having to hold the animal overnight to get the test result or letting it go and then having to catch up with it again, you could just have the result done within an hour and go from there. There are also a couple of other ways to do field tests that aren't PCR, and we're looking into those as well. And some of those might be even easier than doing field PCR, but they're still in earlier stages. So removals is kind of a sensitive part of test to remove. Nobody likes to do removals, and there are a couple of different agencies are using different criteria for removals. Some folks are using, about half of the people that are doing test to remove are removing all animals that test positive, whereas other folks are just looking for those long duration carriers. So animals have to test positive twice over more than 1 year. And overall, the number of removals that people reporting in this survey range from none for people who are starting to 41 in British Columbia, which is where they've caught the most sheep. They've also done the most removals. They're also removing all carriers. But the median is removing about 5 animals. The outcomes that have been reported so far, the first two test to remove efforts in Custer State Park, South Dakota, and in Hells Canyon were successful. Nebraska started not shortly after these two, and they were not successful. And then there's been a couple, one that was ended due to logistical issues, and then one that where the population cleared MOB prior to any removals. So the reason for lack of success is just an inability to clear MOB. And it's not that MOB is cleared and then the population there's no population response, there's no increase in lamb survival. And the difficulty has been like logistics of capture, being able to access the entire population, and or reinfection with from either domestic or wild sheep. And the challenges to doing test and remove are really all centered around captures. It's difficult to capture sheep, especially high proportions of sheep that like we're trying to do in test and remove, and specific sheep. It's just difficult country, and the sheep get pretty good at evading the helicopters. In addition, some of the areas where sheep live are protected, like Department of Defense or wilderness lands. And it can be difficult to find carriers in large populations when aren't very many of them. So in addition to, so that's all I have on the actual test and remove efforts. But in addition to doing that, all the agencies that are doing test and remove are also looking to prevent reinfection. And the 26 populations that were in this survey all had domestic sheep, had MOB from domestic sheep. And domestic sheep and domestic goats are the two hosts for MOB, and they carry genetically different types of MOB, so you can they distinguish them. And they either have gotten MOB, as Daryl kind of alluded to, directly from domestic sheep, or spread by other bighorn sheep populations. And the efforts to prevent reinfection include outreach to farm flocks, a conversion of public lands grazing allotments, and clearing MOB from adjacent connected bighorn sheep populations. So finally, I just wanted to talk about a project that we're getting started at the Wild Sheep Initiative. I mean, it's pretty amazing that we're doing a very similar thing in a number of different contexts, you know, across the range of bighorn sheep. And there's so much data that are being collected. And the Wild Sheep Initiative is a place where the agencies can share data, share information, and learn from each other. And so that's really what this project is about. We're hoping that we can address two questions. One, what does implementation of test and remove involve? You know, what have people learned of how to do it? And, you know, what things have they learned to make it work better? And also, if you're considering doing it, you know, what are you getting yourself into? And secondly, we want to answer the question of how can we improve or simplify implementation? You know, certainly reducing the number of captures would be an awesome thing if we can figure out how to do that. And also, there may be some, as I've kind of touched on, there might be some conditions where test and remove is more likely to be effective than others. And really going to just pull together, we're hoping anyway, to pull together all the data from the different jurisdictions, and you know, try to answer some of these questions, and the ones that we can't answer, you know, come up with ideas for moving forward on how to do that. So with that, I would just like to thank everyone that filled out the survey in the Wild Sheep Initiative. Daryl for supporting this work and its collaboration in the Wild Sheep Initiative. and many other people who've worked on test and remove. And also thank you for listening.
Thank you so much, Frances. And thank you, Daryl. We've got a wealth of knowledge here, and so I'd like to open up to questions at this time. So please unmute and ask questions. Just no question is a bad question. This is a time to collaborate, ask questions, get answers. I just really would like to encourage you all to ask questions.
Yeah, Amanda, this is Steve Gilpatrick. And just wondering, we had the local biologist, Zach Gregory, give a presentation recently here in Du Bois, Wyoming, on the Whiskey Basin herd. And he said they'd never really expect to clear MOV from the herd, but they're still doing test and remove. And that's a fairly large herd, maybe up to 300, 350 animals. But just wondering what that philosophy of, we're not going to ever clear it out of this herd, but we're going to make lamb production a little better if we can get some of the chronic transmitters removed. So what are other people thinking in the other test and remove projects? Do they think they're going to clear it herd-wise, or are they just going to make it better for sheep? And then that would make this almost an annual management event to test and remove some sheep anyway.
I don't know if Daryl wants to talk to that. I have some thoughts too, but.
Yeah, Frances, I think it would be better to hear from you. I think Steve would like to know, in other jurisdictions, are they hoping to, and I mean, I think we're all hoping to clear it, but do other jurisdictions, are they, like in the Fraser River, it looks like they're able to clear it. But are there other jurisdictions like the whiskey herd where it appears, given the prevalence rates, that we're maybe going to have to live with some level of infection?
I do think that clearance is the goal. But it may not happen. It may not happen right away. I think what we're trying to drive MOV to extinction. And I think what you're doing in whiskey is like a step towards that. It might take longer. It may be certain parts of the population clear MOV and have good lamb survival, and other parts don't. I mean, we don't really know. But as I mentioned, some populations have just cleared MOV naturally. And so I think that the fewer carriers you have, the more likely, just like with a animal or any other species, the fewer that you have and the less transmission that's going on. So if you have like subpopulations where there isn't a lot of contact between them within whiskey, I think it's entirely possible that you could clear it from some of those subpopulations, which is kind of what they're doing in the Fraser River. They're going through and working, not trying to work on 800 sheep at once. So I don't know. I think I hear what Steve is saying, and I don't, nobody knows if it will actually be cleared, but I think that you also have to be patient. And I haven't seen any of the data from whiskey, so I can't really speak to whether there's any evidence yet that, the prevalence is going down or lamb survival is going up. But yeah, I think sometimes it just takes a while. Like in Hell's Canyon, it didn't happen after, like the first couple populations, as soon as we cleared the last carrier, everything was great and lambs started surviving. But we had probably lower prevalence than what you have. And then other populations, it took years for them to clear. So
Yeah, so let me just quickly chime in the whiskey herd where we've been working the longest in the Red Creek sub herd. Prevalence rates have come down from a really high of what we estimate to be around 70% to now in the neighborhood, and I'm pulling it up, of 36 to 50%. So it is coming down. And at the same time, we are also seeing, though it's low sample sizes, an increase in lamb survival, at least when we're classifying them in December and January. So we are guarded in saying this, but it appears to be helping.
This is Regina. I have a few more questions. As far as if the Amobi is in populations that are too dense or on the large size, is this just a natural cycle like many other diseases in trees and other animals, or because we think that we're getting them starting from domestic sheep and goats, is this not a natural cycle? And is there any treatments like antibiotics? Is there any immunizations that we can give the sheep? And can some sheep end up clearing the Amobi on their own? So there's a whole bunch of
Yeah, a lot of questions.
thoughts, kind of all on the same thing, like, anyway.
That they've already answered, by the way.
Yeah, so Francis, help me here, but there are no like vaccines that have been developed for the bacteria. They probably could be, but there's not, the incentive from a financial standpoint for pharmaceutical companies to do it. And even if they did, the ability for us, at least in a wild setting, in most wild settings where bighorn sheep exist, delivering that vaccine would be nearly impossible. And then one of the other questions I remembered you asked is, can individuals clear it? And yeah, there are some individuals that do clear it. There are some herds that have gone through an all age die off due to pneumonia caused by MOVI that have bounced right back. There's other herds like the whiskey herd that are have chronically low lamb production and survival and haven't bounced back.
Yeah, I think that's one of the benefits of like gathering all the data from all the different populations, is looking at, why do some populations, are they hit so hard and others bounce back? And there's, could be a number of different reasons for that. So I think that's, going to really help us with being better at managing the disease. And in terms of the vaccine, this came up with in a discussion we had with Amanda ahead of time. And I think you have to remember, like, the situation we're talking about, the ewes they have immunity to MOB. They have antibody. And it's the lambs that are dying. So, and they're not, getting the immunity from their mom. So you would have to capture the lambs and inoculate them before they got infected, which is probably, there's certainly some of them that get infected day one if their mom is infected. So, really there's so many impediments to trying to treat bighorn sheep. And believe me, biologists have tried to treat bighorn sheep with antibiotics and vaccines and vets, vets have been in on this too. And it's just really not a feasible thing. And so that's how we ended up where we are with test and remove, I guess.
Yeah, and then one more point with vaccines is that just like we see with flu every year, there are different, as Francis mentioned earlier, different strains. And it appears to be a lot of different strains. And so you would have to essentially develop a vaccine for all of them. Or at least those that are infecting the herd of interest. So it's not as simple as it sounds.
So domestic sheep don't get treated.
Well, no, I think that's where if we were gonna do something on treating animals, it would be domestic sheep. The one other thing I want to mention about a vaccine is a vaccine does not necessarily clear the pathogen. It just makes you not get sick. It gives the animal resistance, but the pathogen is still circulating. So with domestic sheep, what we're trying to go for is not, have MOV free domestic sheep. And, I think it would probably take a combination of several different treatments for that to happen, and perhaps some culling as well. But it could be possible. And I think there are a number of different folks that have been interested in trying to, seeing if they can make that work. I think the U.S. Sheep Station was also trying to breed sheep that were resistant to MOV infection, domestic sheep. So I think anything we can do to reduce the prevalence of MOV in domestic sheep would also help bighorn sheep, and it would probably help the domestic sheep as well.
At the Wild Sheep Initiative, I saw screenshots of the PCR test results, and I did not see any control positives or control negatives within those screenshots. Do you use control positive and control negatives within your testing?
Yes, we do. And in fact, in the field testing that we did, we just had a capture in Idaho, and we used the Wyoming field test, and we ran positive, negative. I say I did not do any of it, but Dr. Kate Hivert at WSU she's leading this, and she and her lab manager did it in the back of a Yukon. And at the site, and they ran a positive, negative control, and also ran each swab in duplicate.
For the false positive results, is it possible that the outer structure of the DNA cell is not broken, hence the false result?
The test is really designed to not, it's designed to not have false positives. It's very unlikely to have a false positive. I'm not sure what would lead to it. I think has been concern about cross reaction, but I think that's really been resolved with the test as it's conducted now. So yeah, I'm not sure what the reason would be for a false positive.
Thank you.
Yes, I have a question. This is Will Almas. I was just curious about how game managers are handling moving sheep in different locations in different populations. What are the protocols there across the states and the populations that you were talking about?
Yeah, I think I can answer at least that in part, though I'm not familiar with all jurisdictions across bighorn sheep range, but there are several, Wyoming being one of them, that if it's a foraying sheep that we know or suspect has come in contact with domestic sheep, and so have likely at least had an opportunity to contract the pathogen, we remove them when we can. And we do that aggressively.
Yes, I'm aware of how Wyoming does it. I was curious about other locations. It appears to be a remove and test in Wyoming rather than a test and remove.
Well, those are two entirely different concepts, and we are removing sheep if we suspect they have been infected to protect the sheep that we have. So that's different from test and remove. It's done for different reasons.
Yeah, we also remove sheep that we think pose a risk to the bighorn sheep population. Remove like sheep that are in contact with domestic sheep or close to them. If we can, we'll dart them and hold them and run. We're lucky because we live, where I work is right next to Wattle, so we can run the samples up there and they can give us a turnaround within a day. But that's pretty unusual. I mean, most cases we're doing the same thing Wyoming is doing.
Okay, thank you.
So I have one more question for Francis. Colorado was not on your list of doing any test and remove? Are they just not in your study, or you don't know of any places in Colorado doing that?
I don't know of any places. I've talked to Colorado and I think they've thought about it, but they haven't bit the bullet yet. Maybe they're waiting for us to figure things out first, which might be smart.
Can you hear me, Amanda?
Yes. Yes.
First of all, I'm a little intimidated by all of your degrees and publications and everything, because I'm just common, ordinary citizen. And I was amused by your remark that the sheep are clever avoiding the helicopters. But I think the sheep are traumatized, and I think they are driven out of areas by your continual testing. So I'm concerned about that. At the conservation camp, I was up there in early November for a photo workshop, and the Game and Fish had been there just a couple of weeks before with helicopters, and there wasn't a sheep in sight, and they have not come back. So do you take into account the trauma impact of all your, quote, research?
Quote research? That was no, I do. I'm completely with you. I think Daryl is too. Like, if we never had to catch another sheep, we'd be, especially with a helicopter, we'd be just fine with that. Yeah, I don't know what else to say about that. I don't think that it does drive the sheep, at least in my experience. They still use the same areas. I don't know, what the situation was with where,
Well,
that
I
you
haven't come back
described.
to the conservation camp.
Yeah.
And, and I think when they're driven out of areas where they can get some forage, and then on the other hand, we have a wolf pack that is harassing the sheep and driving them into the rocks, and they cannot get to forage. And I don't think anybody's talking about some side effects like that.
Yeah, Lainey, let me just tell you, and first of all, I want to say hi. It's good
Hi.
to see you. Yeah, so Zach Gregory and I made the conscientious decision this year because of the concerns that you raise are valid. that we did not bring the helicopter back to do our annual classifications this year for those reasons. So we too are concerned about the impact of captures. We also suspended the 2 captures per year project in part because of that concern in this herd. So your points are well taken, they're valid, and we are concerned about it. But we are also more concerned about the lasting effects of this doggone bug that we know is driving this herd down.
Yeah, well, I compliment you on, you know, all that research and what your efforts and so forth, but there, you know, I hear a lot of talk around town, you know, that we don't have any sheep to look at, and they're not using that field at the base, right there at the camp. And it just seems like research is, I hope the sheep survive the research.
Well, and Lainey, yeah, I do too. But also know that, you know, the work that the University of Wyoming had been doing, you know, was research that we learned a lot from. And that what we're doing now is management trying to bring this herd back. And that does have some cost. There's no question about that.
So what are you doing about the wolves?
Oh, Jesus.
Well, we have a hunting season in place, and at least based on the collared sheep that we have, wolves have not been an issue yet. We do know when Greg Anderson was still a biologist, he observed the displacement that you talked about, and certainly predation occurs, but it doesn't appear to be significant.
I'd also like to mention that, you know, there's a lot of, you have to take, it's sort of a trade-off. I mean, is a tremendous loss of lambs every year.
That's what Daryl just said. Yeah, I heard him.
Yeah. So, you know, our intentions are to help the sheep. That's the only, it's not to do the research, it's to help the sheep. And when you've watched them struggle with this disease, I think it's clear that in some cases they're not going to get through it without some help.
Thank you. Thank you all. Appreciate all the questions, all the comments, knowledge, research. Just appreciate you all. I think this is important, right? To have these collaborative discussions so that we can move forward and figure out what the issues are. So again, thank you, anybody. Is there any more questions? We are over the hour here, so I'd like to close this webinar as soon as we get a chance here.
Amanda, this is Steve Kilpatrick, and one thing that Francis and Daryl didn't mention, that they've studied the sheep that they've captured over all the years, and over a lot of years anyway. And those ewes that are captured don't have any higher mortality rate than ewes that are not captured. And those ewes that are captured have the same parturition level or rate as uncaptured sheep. So they're not dying from the captures. Just want you to know that for sure. And they're also having babies. They're having lambs, but you know, the ones in whiskey die within a month or so of pneumonia, or a couple months. So they haven't just ignored what the effects of capture are. They looked at it intensively on an individual basis, and they're finding really no negative effects from the capture. If I'm incorrect, then correct me, Daryl or Francis.
Well, no, you're right, based on survival rates and the metrics that we've collected data on. But we do know, just, repeated helicopter exposure, those sheep get wary, they run for the timber quicker, and they are displaced off of habitats where they're captured in the whiskey herd, at least for a couple weeks.
Perfect. Thank you. Appreciate that. All right, well, thank you, everyone. Again, collaborations are extremely important here, so I appreciate everyone's support and collaboration. And with that, I'm going to go ahead and end the webinar for this evening. Thank you for joining us. We were going to have a webinar next week on horns versus hunting. That is actually going to be delayed. We're still waiting on some approvals. So we're going to have that webinar in June. But tune in next month. We're going to have a great webinar on food from the field. So thank you all again, and have a good evening.
Thank you, Amanda.
Thank you.